picture showing multiple well-defined light brown to dark brown verrucous looking papules involving the lateral side of the neck of a young boy. The site is not clear to me here. Some are discrete, few are in a grouped distribution. My provisional diagnosis is verrucous epidermal nevus. Okay, now on examination, it's a young looking boy sitting comfortably on chair. First of all, I would I would inspect the lesion for the site, and also I'll do it with the magnifying glass. Then upon palpation, I will first of all I will palpate it for presence of any tenderness, and if there is any induration or if the lesions are fixed, I'll move them in all four directions to check for fixity to any underlying structures. Then I will check for any temperature difference, and then I will squeeze one of the papules to see if there is any extrusion of sebaceous material. Then I will measure the whole involved area in both dimensions, and after measuring, after that, I will examine the rest of the body for the presence of the similar looking lesions elsewhere. Especially, I will examine the extensors of the upper limbs and the rest of the body to rule out the presence of any psoriasiform plaques. Then I will examine the head. I will examine the scalp for to rule out the presence of aplasia cutis. Then I will examine the eyes. I will check the vision. I will give the card to the boy to read, and then I will make an etch for to check the movements of all the extraocular muscles. Then I will perform the cover test to check for strabismus. I'll cover the one eye of the patient and ask the patient to look at the light of my torch, and I will observe the eye for any movements. If there are any abnormal movements or any squint, then I will repeat the same procedure for the other eye. Then I will examine the oral cavity. I will see if there are any teeth abnormalities. Then I will palpate the thyroid gland and also the axillary lymph nodes. And then I will examine the nails of both hands. I will examine the both upper limbs for the tone, and I will move them and I'll examine the tone. Then I will ask the patient to hold my fingers and make a fist and pull towards him to check for the power. And after that, I will examine the spine of the boy and see if there is any kyphoscoliosis or any lateral bending of the spine. And after that, I will check the tone of the lower limbs as well. And in the end, I will ask the boy to walk, and I'll check the gait if there is any gait abnormality or if there is any limb shortening while walking. That's it.